George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. Well, we have got a sister here that's going to help us all with a couple of topics that are of major concern to many of us: our hair and hair loss and our skin. Dr. Yolanda Lenzy is a board certified dermatologist. She's a cosmetologist and she's a hair loss expert. Her book is called Getting to the Root, or as some folk like to say, Getting to the Root. Now I say Getting to the Root. and so that book is available as an ebook. But lots of tips for growing hair and hair challenges and problems. Now, you're based in Chicopee, Massachusetts, so let me just say this. Guess where my wife is from? Springfield, Massachusetts. How about that?
Okay.
So we almost family, Doc.
Yes.
In fact, even more, I got married in Springfield. So there, yeah.
Okay, awesome.
We got married in Springfield 29 years ago in Springfield, Mass, right on Bay Street. So
okay, cool.
How about that, right? Right.
Yes.
So we're obviously in Springfield a lot. Her mom and grew up. That she was raised in Springfield and still has family there. So we were actually there about a month and a half ago. So
oh, cool.
Yeah, so that was my little Springfield story for you.
Yes, that's cool.
Yeah. So
awesome.
So let's talk about this. I mean, there's so many issues here, but let's talk about you and how you decided on a career not only in dermatology but in cosmetology.
Sure. So when I was about 13 years old, I developed eczema, which is an itchy skin condition that a lot of children often develop. And I started to develop like light spots on my skin that I was really nervous about. So my mother actually took me to a dermatologist. She was actually my first experience with an African-American physician. And she just really inspired me. She was beautiful. She was articulate. She was able to explain to me in a way that I could understand what was going on. And I left there that day really inspired. I was like, wow, I think I like what that lady did. I think I want to do that. And so my mother worked at the hospital where Dr. McKinley Grant worked. And so she said, my daughter keeps talking about you. So she's like, oh, bring her in and let her shadow. So she gave me a little white coat and I was like, oh, wow, I love this. I love the diversity of patients that she saw. She saw little babies all the way up to people who are 100 years old or more, and the diversity of conditions that she saw. And so around the same time, my high school, I'm from the DC area, and my high school offered cosmetology. So I always had a knack for doing hair. And so I got the idea to integrate my love for science and math and medicine with my love for the beauty industry and hair to become a hair loss physician. And so that's how that all came together.
So, wow, there's a lot just to unpack even in that. But I want to say I just want to take a pause to say how important it is to expose our children to so many different things. You never take for granted what that little bit of exposure, and you stayed true to that path, right? Did you ever deviate from wanting to be a dermatologist, or you stay with that?
Yeah, I mean, I got exposure to it, and I would continue to go and shadow Dr. McKinley Grant as I matriculated into college and then medical school. And then when I got to medical school, I said I would keep an open mind, but all of the other rotations, what I liked about them were just confirmatory of what I liked about dermatology, because we get to do procedures, we get to do, medical treatments, cosmetic treatments. And so it's just been the best option for me within medicine. So it's pretty much been that exposure really opened me up. I think before that, I was probably thinking about going into law. And now that I'm glad I did not go into law, but I was actually thinking about it, probably before I met the doctor. And so, so it was just a great exposure. And then it just opened me up, as you said, to this whole career.
So what'd you do undergrad? What'd you do med school? Let's get the Vita out here.
Oh, sure. I went to undergrad at American University in DC. I majored in biochemistry and health promotion. And I wanted to be able to think about how I could use my training in order to help individuals become healthier on a broader
Mm-hmm.
level.
Sure.
And then I did a year of research at the NIH and then medical school at the University of Maryland in Baltimore.
Nice. Very
And then
nice.
after that, before I started my residency in dermatology, I decided to do a master's in public health, kind of continuing in that sort of public health interest. And I did a MPH at Harvard for a year before starting my residency in dermatology at Boston University.
So you got a chance to really uh connect around some really big cities, right?
Yes, absolutely.
And now you're in homespun Springfield, right?
Yes, yes.
um, so let's talk about hair loss. Now, your patients are uh, both men and women, I assume.
Yes.
And let's talk about for men, balding, right? Number
Mhm.
one. And or in some cases, the hairline just, uh, the Wayne Brady effect. I don't want to call no names, but you know what I'm saying. The hairline just
Mhm.
keeps, and then you go bald. So, talk to me about hair loss when it's just genetic, or when it's a condition, or just explain hair loss to me. You're the hair loss
Sure.
expert. Wait. Wait.
Absolutely.
Let me do this. Can you just get to the root of that, just so like?
Oh, good one. So, how we break down hair loss is kind of into two major categories. Some forms of hair loss are non-scarring or more temporary forms of hair loss, meaning the hair can potentially grow back. And then there are some permanent forms of scarring
Mhm,
alopecia.
mhm,
So, what the majority of males develop is called male pattern baldness, or it's also called androgenetic alopecia. And
mhm,
so, like about 70% of men develop this form of hair loss at some point in life. And
mhm,
in this form of hair loss, the hair follicles start to get smaller and smaller to the point that they produce thinner and thinner hairs.
mhm,
And those thinner hairs become like non-existent to the naked eye. I mean, I can often see them with my little microscope,
mhm.
but they get smaller and smaller. And so the great news is there's been a lot of development
Mhm.
over the past decade in terms of treatment, because I think for men traditionally they didn't treat it and they would just say, I'll just go bald and shave it all
Right,
off.
right.
And so, but now, especially when we catch it early, we can put people on a regimen that can consist of sometimes just topical things like Rogaine, to some oral medications, to even more cutting edge things that we're doing now with growth factors and lasers.
Mhm.
So there's like a whole lot of different options for men who are dealing with hair loss, and women as well.
Yeah.
For women, shaving the head bald is a typical acceptable option for women. So we tend to see a lot more women come in for treatment. But the first step in whichever form of male or female child, we even see children with hair loss, is to get a diagnosis of the
Mhm,
specific type of hair
mhm,
loss,
mhm.
because there's some 15 different forms of hair loss. And so the first step we do when we bring a patient in is we do take a history, we do an examination, we go through the scalp and see the areas of decreased density, and then we decide if we need to do a test called a biopsy, where we take a sample and send it to the pathologist. Or sometimes we draw blood work because there are certain situations where certain labs can be off, like your thyroid, your iron levels, things like that can be off when you have certain forms of hair loss. And so I really enjoy working patients up with this, because it's kind of like detective work.
Right.
So we look at it and then see like what may be going on. And so it's a lot of history taking and then correlating that with what we see.
Um, we're talking with Dr. Yolanda Lenzy. She's a board certified dermatologist, cosmetologist, and hair loss expert. We're talking about hair loss. Who is the congresswoman and I can't think of her name off the top of my head. Do you have her? I can't think of her name,
Yeah.
but I think she had.
Ayanna Presley.
Yes, Ayanna
Yeah.
Presley. Thank you.
Mhm.
Yes, Ayanna. I was like, what is it? I had it right here, but
Yeah.
and so she had alopecia, and she was wearing wigs, and then she finally decided that she was going to show, uh, be comfortable, right, with
Mhm.
that. And so, talk to me about alopecia because I know that I know there's people that have it, and is it treatable? And if it is, when do you have to catch it, or is it a point where it's too late after?
Sure. So the type that she has is called alopecia areata. So
Mm-hmm.
all forms of alopecia have a first name and a last name. Most people just call it alopecia for short, but it's really alopecia areata. And this is an autoimmune form of hair loss.
Mm-hmm.
And what happens in that form of hair loss is that the body produces T cells, which go and attack the hair follicles.
Mm-hmm.
And so it typically presents with circular patches of hair loss. Sometimes some patients can just have just one or two patches.
Mm-hmm.
However, in about 10% of the cases, it can progress to the entire scalp, and we call that alopecia totalis. Sometimes, rarely, patients can develop total body hair loss where they lose their eyebrows, eyelashes, and the body hair. And we call that alopecia universalis.
Mm-hmm.
So those two types are a little bit more rare, can happen in about 10% of the cases of alopecia areata. And though once it becomes total hair loss, it's definitely more difficult to treat. But there are some treatments that are on the pike that are in clinical trials that there's been a lot of study on that hopefully they will be getting approved in the coming, can't even give a time horizon, hopefully in the next year or so, because they're in like stage 3 trials that have the ability to regrow the hair back by targeting those T cells, which are going awry. And so that is a pretty common form of hair loss we see. Most people don't present with the full total hair loss, but some patients decide to go ahead and shave the rest of their hair because say they have 75% of it involved or 50%. So it really just kind of depends. And some people just decide I'm just going to rock it bald.
Wow, there's so many questions I have. So let me go back to a couple of them. So, like, what did Deion Sanders do? That because he did plugs or something? Is that another way to what is
Yeah,
that?
I wasn't familiar with Dion. I know LeBron
LeBron.
James.
Okay,
LeBron, yeah, I know
Deion
LeBron.
did it first, actually.
Oh
Right?
yeah, I'm sure. I just don't remember what Dion used to look like. but,
Yeah.
but definitely, I remember LeBron going through male pattern thinning, and he has talked about having a hair transplant. So a
Right.
hair transplant is a treatment that's used for mainly non-scarring forms of hair loss, like male pattern thinning, female pattern thinning, where
Mm-hmm.
follicles are taken usually from the back of the scalp, and they are dissected into small individual piece follicles, and then transplanted into the affected area, usually in the crown. And so that works really well as a way to cover a large patch of hair
And
loss from thinning.
does that hair grow again?
Yeah. So the concept of why hair transplantation works is a concept called donor dominant. So the follicles in the back, they don't undergo that miniaturization process that I talked about earlier, where they get smaller and smaller. So basically, we are going to use that principle where the follicles that are still large, they are transplanted into the area that has smaller follicles, and then the hairs here, they grow from the way that they grow in the back. So it's really a cool concept of how you can move follicles from one area of the scalp to another.
Now, I know your practice is, you serve all patients, but can I talk to you about the sisters for a minute? Can we do that?
Sure.
Okay.
Yeah.
So let's talk about Black women and
Mhm.
all the different things that we see Black women doing to their hair. And some of it is healthy and some of it, well, how do we help sisters with the hair growth? Let's talk about that, because, and also the trauma of Black women in their hair, just trying to get it, the politicization of it, all of that. I'm just throwing all of that at you, Doc. Take it.
No, yes, big topic. Yeah, so for many years and for many reasons, there is, challenging relationships that many Black women have with our hair. And so from, even being told our hair is not professional and it needs to be in this certain aesthetic in order to be accepted. And so what I love is a lot more people are embracing a lot more natural hairstyles and things that were traditionally frowned upon. And so, but one of the things that we do know is that some of the hair care practices that Black women have traditionally done have been very problematic in terms of exacerbating hair loss, mainly traction alopecia. So that's loss of edges, right? Everybody always talks about the edges.
Traction alopecia, okay.
Traction alopecia, yeah. So for a lot of individuals who wear chronic braids. So we're not talking about occasional braids, but we're talking about
that's your
people
style.
who wear, people who wear braids is their main style, meaning they have it in for a few months, they take it out, they put it right back in. They take it out and they put it right back in. So like, Stevie Wonder, Susan Taylor, those are people who we've seen their hairlines, go back from traction alopecia. And so, so that's clearly a form of hair loss that can be prevented by avoiding chronic use of styles that put a lot of weight and tension on the follicles. And sometimes, traditionally people's like, well, it's not tight. And it's not always very tight. It's just a lot of the added hair is very heavy, and that provides a weight on those follicles. And so we want to, I always say, rotate our hairstyle. So it's important to, if we enjoy these hairstyles, give our follicles a break, if you will, and just wear our natural hair out. Super important.
Now I want to ask. That's a great point. But Susan Taylor became a brand with that hairstyle. So what was, there was really nothing else she could do at that point, because that was her brand. So are you basically saying that that was going to be the fate of someone who created a brand that meant that that's how they were going to wear their hair all the time?
Yeah, it's the all the time aspect of it. I mean,
Right.
like we've seen even Stevie Wonder through the years, with his locks pulled back, we've seen his hairline go further and further back. And like I said, that's her iconic brand.
Right.
But definitely it's just an example that we, many of us have seen evolve over the years. And you can clearly see how it progresses.
I'm thinking about conditioning. I'm thinking about hot comb straightening. There's this is anecdotal, but I'll say there's a lot more interest in natural hair care. And so let's go down that road for a minute.
Sure. Yeah, so definitely over the past, I would say 5 to 10 years, natural hair styles have become very, very popular. Even a lot of the consumer research have documented that relaxer sales are down about 25 to 30% over the past 5 years compared to like the 90s when
Doc, right there. Can you stop right there, Doc?
Yes.
What do we mean? I think we need to define, what do we mean by natural hair? Because you said not relaxed. So what do we mean by natural hair? Is that a good question?
Yeah, that's a great question. So natural hair is hair that has not been altered by chemical straighteners.
Okay.
And so usually chemical relaxers are the most common ways of chemically straightening the hair.
Okay.
And so natural hairstyles can be done in a number of different ways. You can roll it, you can set it, you can twist it, lock it, braid it, all of those kind of fall under that. But in general, it's not hair that has not been altered with chemical straightening. Some purists consider if you have color, it's still not natural, but I consider color natural hair can be, hair with hair color,
It can
but
be a
some
different
purists,
color than the.
yeah. But
But
some purists say natural is just no chemicals at all in that hair color. But I think, just in terms of the straightening aspect.
so if I put coconut oil or shea butter or whatever the other things are, that's not, as long as it's not chemically straightening or relaxing, I'm good. Not me, but for the sisters and brothers too, I
Yeah,
guess.
well, I mean, I don't really define hair as good or bad. It's, there are people who
What?
have relaxed hair that's very healthy. And
Right.
so I think it's not just about, labeling things as good or bad. It's just
Yeah,
about
and
how
I
it's
didn't mean
done.
to actually imply that. So
Okay.
yeah, no, what I meant, I'm just trying to understand, if you're saying your natural hair, then what does that mean in terms of what you put on it to create that look that you want? Because you, like you said, people could do whatever they want. I just wanted to get a sense of that, because here's where that question was going. The use of chemicals and other things has caused damage to some women. And so that's
Mhm.
kind of what I was thinking of. Is that the
Oh,
right?
yeah.
That's where I was going with that.
Oh yeah, absolutely. So, a number of different, when one thing goes down, sometimes a whole nother category comes up. So there is a whole category of products
Right,
for
right.
that are targeted towards natural hair. Some of them helpful, some of them, not. So it just really depends on how an individual is going to wear their hair, whether they are going to use like a botanical gel, whether they're going to use a cream or a foam, but a whole host of things that are helping styling products that can help enhance the natural hair depending on what aesthetic a person is going for.
A lot of weaves, obviously, and extensions are also a big part of hair care right now. How do, if you're wearing a weave, or what do they call it, sewing, all of these things, how do you do that and keep your hair and your natural hair healthy?
Sure. So that's a really great question. I kind of lump sew and weaves kind of in the guidance that I gave earlier around braids. I think when people wear them, in a rotation, it's fine. But when people do them chronically, because we under a sew and weave, the hair is cornrowed, and so it's braided underneath. The natural hair is braided, and then the hair is sewn to that. And so that can provide traction, tension that can be placed on those follicles. It's like chronically over and over again. Also, it's an issue of there's not as much air circulation
Mm-hmm.
with a lot of that. A lot of people put a net over the braids and then sew it in. So those follicles aren't really, I feel, breathing as well. And then there's issues around shampooing, if you can really get in there and cleanse it the way that it needs to be done. So I think also with someone we use, those styles can be done, but they also should be rotated,
Mm-hmm.
in and out, just like any other type of hairstyle.
How do you promote hair growth?
How do you promote hair growth? Yes, that's the age old question. So
Yes, I want, because back in the day, we went to the store and it was, what's the Afro Sheen, Soft Sheen, the blue, the blue grease, the green
Blue
grease.
Magic, yeah.
Blue magic, yes.
So how do we promote hair growth? So let me just start by saying the hair naturally grows. If there is no condition in which is preventing the hair from growing, the hair is naturally going to grow. So
Mhm.
we don't have to necessarily promote growth
Right.
unless there is a problem or there's
Hmm.
a challenge.
Hmm.
So getting back to what I said earlier, the first step is to diagnose, why
Diagnose.
is the hair not growing?
Okay.
Why is the hair not responding the way it should naturally
Hmm.
respond if it's in this ideal state and in this ideal environment? So I
Right.
always get back to that. But because people always ask me, should I take vitamins? Should I do this? Should I do that?
Georgia,
And
what's that? Jojoba oil or whatever it is?
yeah, all kinds of things. And so really the focus is focusing on our overall health. So if our overall health is in order, meaning we are eating well, we're eating clean fruits and vegetables, lean protein, we are avoiding kind of inflammatory foods, because for some people, some inflammatory foods like dairy, red meat, for some people can make their scalp flare up, especially if
Really?
especially even dandruff. So a condition called seborrheic dermatitis, where you get this inflammatory dandruff that's like really itchy and flaky. Some people notice that when their diet is not in, as clean as they would like it to be, that their scalp flares up more, because yeast lives on all of our scalps, and sometimes it can overgrow, with certain foods.
What about as I'm thinking about, let's just continue down that path. So you said that certain foods impact our hair loss. I would also think that there are certain things that also exacerbate hair loss. So let's stay with dandruff for a minute. What is dandruff?
Sure. So dandruff is generally a condition called seborrheic dermatitis, and it's a condition where a yeast called Malassezia, it can overgrow on the scalp, and
Mhm.
it can cause a lot of flaking, a lot of itching. And this is where I always like to just take a moment to remind everyone that oiling the scalp or adding grease to the scalp, with that blue magic stuff, all those things we used to use back in the day, can actually exacerbate or worsen the seborrheic dermatitis, because it actually provides food for the yeast.
Mm.
And so our scalp makes a natural oily substance called sebum. And so we really don't need to apply oils and greases to the scalp, because it can often worsen
So you
some
you
inflammatory
you
conditions.
you just messed up a whole tradition of black hair, because everybody done sat down and had the. In fact, it's a ritual to have
It's
your
a
scalp
ritual.
greased, right?
Yes.
And part the
Mhm.
hair and take the.
Pardon.
Come on now, doctor, you telling me
Mhm.
I don't need to grease my scalp? Because someone told me the other day, your scalp, if your scalp is dry, right, then you need to put some grease on it. And you telling me not necessarily? Is it? If there's anything that you just said today that's breaking news, I need to hear this now. Can I have that confirmed? I don't need to put grease on my hair?
You don't need to put grease on your scalp.
Yeah,
So
wow.
yeah.
That's a
So
thing. All right,
figuring
so
out.
wait, hold on. So how brothers gonna get them finger waves? How they gonna get them finger waves?
Yes, that's a whole nother
That's a whole nother
thing.
thing. Okay,
That's a
okay.
whole nother thing. But we definitely can see that greasing and oiling the scalp can cause and so it's interesting, because initially, the say someone's has a quote unquote dry flaky scalp, and they put the grease on, it looks like it's got better. Then you
Right.
go in the next day, and the flakes are even bigger, and they
Bigger.
overgrow even more, and so you're actually worsening that issue. And so we definitely like to give education for patients around that, and
What,
just help promote a clean scalp. And so a lot of times, some of us are not shampooing as frequently as
well,
we could.
stop right there. I want to
Mhm,
ask about that
mhm.
because I'm just gonna say it. Black folk don't think they gotta wash their hair as much as other folk do.
We don't have to wash as much as some other ethnicities do, but some of us don't shampoo probably enough. And
Enough.
because when you think about it, we are sweating, we're exercising, we're
Hmm.
we're applying different things, products on, and those things can build up. And so generally, I'm of the belief of like every 7 days, 10 days max is a good interval, especially because if you're active and you're
And
exercising as we should.
and if you have the sew in or the weave, how are you gonna do that?
So that's challenging. And
Right.
so therein lies the challenge. And so even having braids in, a lot of people don't want. You can certainly shampoo with braids in, but they're going to get a little bit more fuzzy. So it may compromise the style a bit. And so herein lies, these decisions that we have to make, which can be hard, to do, because you don't just pay money and you don't necessarily want to quote unquote mess up your style.
Did I get all my stuff? And you talked about washing the hair. We talked about, so what am I putting on my scalp then? If I ain't putting grease on it or baby oil or shea butter or coconut oil, what am I putting on my scalp?
You don't have to necessarily put anything on your scalp, but a water-based product is
Okay.
going to be what we recommend. Something where the first ingredient is water versus the first ingredient being an oil or petroleum, something like that.
Glycerin or something like that. Is that?
Yeah, that can certainly be done.
Okay.
Yeah, absolutely.
All right, because I use that on. So I know we spent a lot of time on hair loss. So I guess for the skin stuff, we probably have to have you come back. But I am going to ask about a couple of things. Okay. So, well, let me stay with hair loss for a minute. I'm sorry, because stress and menopause and postpartum. Talk about all of those factors and their contribution to hair loss: stress, postpartum, and menopause.
Absolutely. So that's great that you lump them together, because definitely stress and postpartum, those two can cause the same form of hair loss. It's a condition called TE, or telogen effluvium. And I have a chapter on all of these different forms of hair loss in my book, Get Into the Root, if you want to learn more. But a number of different triggers. So stress, having a baby, having surgery, having major weight loss, all of these can cause our hairs to shift into the shedding phase called telogen. So our hair exists in three phases. It grows in the anagen phase, it goes through the resting catagen phase, and then it goes through the telogen phase. So when there's been a major stressor, which having a baby is postpartum, major stress can cause our hairs to cycle to the shedding phase, and we can lose more than the normal. So we normally lose about 100 to 200 strands per day. During telogen effluvium, you can lose 300 to 400 strands per day. And you can see a lot of hair come out. The good news is it tends to last about 6 months or so, then it stops. However, about 10% of the time, telogen effluvium can be chronic, and it can continue despite getting, being no longer really postpartum, despite getting the stress under control. But the majority of the people, it's a self-limiting about 6 to 9 months of excessive shedding. And so it's important during these times to take care of the hair. Some people get scared to shampoo because they see the hair come out more when they shampoo. But the hair has already shed. It's already released. It's just kind of sitting there. And so a lot of my patients get scared to shampoo because that's when they, see it come out. But it's just a natural process. Even because postpartum, when you think about it, George, when women are pregnant, their estrogen and their progesterone are high, so they don't shed hair. So, that's why people say during pregnancy, oh, I was glowing, my hair grew like crazy. It's because, and so what goes up must come down. So during pregnancy, women typically don't shed the normal amount of daily strands. And then after postpartum, that hair releases.
And so stress, I did say I was going to save the skin stuff, but I also think that not only is hair loss, but also acne. And now, is that a myth? I am of the firm belief, and you can just dispel my belief right here, right now, that if you're not getting enough rest, if you are run down and tired, that could cause an acne outbreak. Or let me say it in the way I understand it, that the stress levels in your body can produce an outbreak on your skin that shows up as acne. So did my medical 101 pass, or do I need to go back to school?
I think partially. So
yes.
I think for people who are predisposed to acne, it can certainly exacerbate a flare.
Yes.
Because acne is a number of different factors. One is excessive sebum production. 2 is clogged pores. 3, there's bacteria that exist in the skin like follicles.
Mhm.
So all of those things can contribute to acne. And so stress and being run down, we definitely can see exacerbation of these conditions. But I don't think it's a stress alone. If you don't have acne prone skin, meaning you don't have oilier skin, you don't have skin that tends to get clogged, your follicles get congested, your pores get congested. I don't think you would just develop acne all of a sudden, but usually in people who are prone to acne for certain, it can exacerbate it for sure.
It can exacerbate it for sure.
Mm-hmm.
And there's one more thing I want to talk about with skin is eczema, which
Mm-hmm.
so many people end up having. Talk to me about what the treatment is. Oh, wait, and for treatment for eczema, but let me go back. I'm still on this hair thing. What about shea butter? Got a lot of shea butter up in here. Can I use shea butter on my scalp and be all right?
Again, the scalp, I'm not a fan of putting a lot of extra oils and butters
You're
on
just
the
not a
scalp.
fan.
Yeah,
Okay.
I'm
I
just
didn't answer three different ways. She said, no, no, no.
because I just see the things that it can cause, and even with hair being, everybody's talking about hair being hydrated and things like that.
Right.
Sometimes raw oils and butter can prevent the hair from being able to become hydrated, which is the
Okay.
only way to hydrate hair is from water
Okay.
and water-based products. Yes, so shampooing that's when your hair is the most hydrated, when it's soaking wet. And so it's important. So this is like totally a sea change from like the way we grew up. We were just taught we need to add oils and things to make
All day
sure
and
our
all
hair is
night. Your hair's
hydrated.
dry. Get you some. And if you didn't have the blue or the red or whatever, it was Vaseline. Don't hate on me, y'all. Y'all know what was up, for real, for real.
Now, Vaseline is wonderful for the skin. We love it. You mentioned eczema. We love Vaseline for the skin because individuals with eczema, they don't retain moisture. So when you think about eczema, I like to explain it like brick and mortar on a house. So, you have the bricks and then you have the cement in
Mhm.
between the bricks. And so people with eczema, they have a mutation in one of the proteins that keeps the skin cells together.
Mhm.
And so when the skin cells are not together, you get epidermal water loss. So you get water loss, and then the skin gets extremely dry. And then there's this inflammatory cascade that happens where you get itching and then you get a rash. So we call eczema really the rash, the itch that rashes. So it's like
Mhm.
a
Mhm.
whole,
And
chronic thing that happens.
does it ever go away, or is it treated?
Yeah, so the majority of children with eczema outgrow it by the age of like 3 years old.
Right.
However, 10% of people can persist into adulthood with their eczema. So that's something that's important to keep in mind. And for the people who continue with it, there are definitely great treatments. So there's
Mhm.
not necessarily a cure, but
Mhm.
there are some wonderful treatments from topical to even you may have seen commercials now. There's biologic treatments, injectable treatments for people with eczema that really target those inflammatory factors that are elevated in people with eczema. So, so there's been a lot of research and development in eczema over the past couple years.
All right, so I want you to I'm gonna look at my skin, right? Can you tell me what kind of skin you think I have just based on what you can see through this camera? What kind of skin do you think I have?
I mean, we usually ask patients questions to
Yes.
kind of determine skin type. So, like, kind of like first thing in the morning, does your skin feel more oily or does it feel more dry? Some people have combination skin where the T zone is more oily and the cheeks and the chin are more dry. And so those are things that are gained more from history. If you see a lot of shine, more people tend to have oilier skin, but sometimes it could just be product that they have on. They
Right.
have
Right.
Vaseline or things like that, which can make it shiny. So it's kind of difficult to look at someone's skin unless it's extremely like oily or extremely dry. You can tell, but for the majority of people who are keeping their skin in balance by the cleansers they're using and the moisturizer, you can't really not necessarily look at it and tell.
I keep saying we're gonna go, but then I keep coming up with more questions. So, in terms of daily skincare, I guess I can't leave you without asking you about that. and for both men and women. And I keep hearing about exfoliate, exfoliate, exfoliate. And so, what's your skincare suggestion for us in terms of what we use? Should we use lotion? What kind of lotion? Uh, is Nivea, do you still use that? That's a cream. I don't know what you do with that, but all of these kinds of things. Cocoa butter, that's a big one for us in the community. So let's talk about
Sure,
facial skincare and like and even body. What do you put on your body? So all of
sure.
that wrapped into one.
Absolutely. Barring there are no diagnoses like acne or eczema, when it's just normal skin. Because if you have those things, we're going to recommend things that are going to target that.
Right.
So we're talking about individuals that don't have any skin issues going on. I think a nice gentle cleanser is a good way to go. Looking a lot of the research on ceramides. These are proteins that help increase the moisture in the skin are really helpful. There are certain brands that have ceramides like CeraVe. I like those products are pretty widely available, very in most drugstores. So you want to use a gentle cleanser. You want to cleanse with your best cleanse, tool is your clean hands to cleanse the skin, moisturize afterwards, and then sunscreen. I will be remiss if I did not.
Black
And a
folk
lot of
don't think
people,
they need something. Look,
yeah, we definitely need sunscreen.
this is
Um,
this is PF 30. Now,
Good. I like
suns
30.
sunscreen, whether you're heavily melanated or not, and this is where I heard this recently. You'll confirm this all the time, and not
All the
just
time.
right. That's a thing. Right now, it's not just
365.
yes,
Yes,
right. That's
absolutely. And really for a lot of heavily melanated skin, we often deal with a lot of hyperpigmentation.
mhm.
So from old acne, old eczema, picking zits and things like that. And so the sun can actually cause that hyperpigmentation to get worse. And
Mhm.
so, even though our risk of skin cancer is lower, the sunscreen is the best anti-aging, defense that we can have, because the sun often causes more fine lines and wrinkles as well. So it makes the pigment worse, and it causes more fine lines and wrinkles. And so there are sunscreen challenges. Sometimes some of the sunscreens cause a grayish white
Yes,
cast
they
of
do.
skin
Yeah.
of
So
color.
give me one we could use, okay, please.
Yeah, so generally you want to look probably for a tinted sunscreen, one that
Tinted.
when it comes out, it actually looks brown. And so the tint is even good because it has iron oxides, which helps to prevent from visible light. And
Oh,
so a lot of studies have shown that the light from devices like our phones and our iPads and our computer screens can worsen hyperpigmentation as well.
ooh.
And so, super important to wear
So
sunscreen, because a lot of people are like, I'm at home all day working from home, and so I don't need sunscreen. I'm like, yeah, yes, you do. Put it on just the
um
same.
I mean, I know this is like, but do you have a brand for this tinted sunscreen, please?
Yeah, sure. I mean, one that we carry in our office is called Isdin, Isdin. I like that one because it just blends beautifully in with skin. So, it's a little bit more high-end one that CeraVe has one. You just kind of sometimes it's trial and error, but I've kind of tried a lot of the ones, and
Will
I know what I like,
and will
what
it say
yeah.
tinted if you're going over the counter?
Yes, it will say tinted. It will
Okay.
say
Oh boy,
tinted.
we gotta look for that.
Mm-hmm.
Well, Doc, there's a million
Absolutely.
more questions. And so I'm gonna just have to leave my listeners wanting more. But they can get these answers in your book, Getting to the Root, a dermatologist and cosmetologist guide to understanding hair. And as you
Yeah.
can tell, Dr. Lenzy knows a little something about hair. And you also have another book called The Hair Diet.
Yes.
So both
That goes over some tips, because you asked earlier about things we could eat. And so that book goes over the different nutrients, what foods are contained, which can help hair growth.
her website is lenzy derm derm.com, lenzyderm.com. where you can find these books. We'll have a link for you. And Doc, I don't know if I asked all the questions that everybody wanted, but this is a start. So I'm thinking the next thing we got to do is have like a Facebook Live and take questions from the audience like that. If you're down for that, we'll schedule that for some time later on too.
Okay, awesome. Sounds great.
Listen, any lasting advice you have for us before we go?
Sure. I just always encourage individuals, if you're dealing with a hair or skin concern, to get it addressed with a professional right away. A board certified dermatologist is going to be able to diagnose and get you on a treatment regimen ASAP, so that you don't have to just try so many different things. So many patients just spend so much money going to the store, going on Amazon, just buying this, buying that, where you can really get expert advice for your particular concern. So I think it's definitely worth the time and energy, and you'll save money and in the long run by doing that. So if any individuals is interested in finding a dermatologist, and if you want a dermatologist of color, there's a resource that I wanted to share called blackdermdirectory.com. And you can actually search by zip code on there. And I'm on there, and some of my other colleagues around the country are there.
And what I know we just came out of COVID. Are you doing, if someone can't find one there, could they call you, or could you consult with them over the phone or over this video, over the video?
We do virtual consultations, which on our website, lenzyderm.com, you can get more information about that.
Dr. Yolanda Lenzy, she's a cosmetologist, a hair loss expert, and a dermatologist, more importantly. Dr. Yolanda Lenzy, thank you so much.
Thank you so much. Have a good night.
It's inspiration for the nation.